Thank you everyone for being here. My name is Dr. Erin Schulte. I am the coordinator of counseling and character education for the Parkway School District. We are joined tonight by Chris White. She is the department leader of the West Middle counseling team and helped greatly in helping set up this second mental health event that we've had this year. And then our presenter tonight is Elizabeth. And I'm sorry, Elizabeth, you're going to have to say your last name again because I totally am blanking.
Sure, McCulloch, Elizabeth McCulloch.
Elizabeth McCulloch from Kudo, Kids Under 21. And as you all saw when you signed up, she's going to be presenting tonight on non-suicidal self-injury, what to look out for and what you can do. So with that, I'll give it to you and you're welcome to screen share if you'd like.
Yeah, let me pull that up right now. Great. Oops, jumped ahead of myself. So yes, thank you for this opportunity to spend some time with you this evening. I really appreciate it. I'm Dr. Schulte and Ms. White for coordinating this, and somebody that you likely will not see, but Jason Rooks has been the tech guy that's really sort of pulling this all together. So I really appreciate the opportunity. I've had the chance to work a number of times with the Parkway School District, and I appreciate that opportunity to help be part of the process of helping staff and parents and students help their students feel a little bit safer when it comes to issues that are related to their mental health or behavioral wellness. It's definitely a serious topic. It's at the top of everybody's mind right now. There's so many different things going on that are distracting us or burdening us or overwhelming us, that being able to have a good, safe place to debrief as well as to de-escalate some of these things is important. And also recognizing the very different ways that people cope and try to manage with some of the emotional stress and pain that they might be experiencing as a result of circumstances that either are within their control or beyond their control. So I'm going to spend some time today sharing with you. Yeah, well, there we go. What we're going to talk about today is we're going to talk about self-injury, what it is, what it isn't, how it can be related to suicidal behaviors, talk about how frequently and how different methods people might use to practice self-injury, things to be alert and aware of, how you can initiate a conversation with a young person or really anybody of any age that you may be concerned about them engaging in that destructive behavior. I have a few tips and ideas on how to initiate perhaps an intervention and then get connected with community resources that might be helpful and beneficial. And we'll just sort of launch from there. So there are two different types of self-injurious behaviors. The first is non-suicidal self-injury, which is intentional and deliberate, destructing body tissue. What makes it very different from suicidal behavior is that there is no intent that the result will be death. So deliberately injuring, destructing, altering our physical body in some way without really wanting to die. And then the other type is suicide attempts, because we know that in some cases, suicidal behavior can result in periodic episodic behaviors that are either pretty low key, pretty low risk, or can sometimes escalate to be much higher risk. So when we're talking about non-suicidal self-injury, many people refer to this as cutting or self-harm. We really try to use the language of self-injury. There are many different ways that people may self-injure. And harm is very different than injury. Harm can be very, as I said a moment ago, very low risk. Harm is in the perspective of the person that's engaging in it. And really what we want to make very clear is that there is some very true and real physical injury that is resulting that could escalate to a significant medical concern if that behavior were to escalate. So some features of self-injury include the physical piece of it. Here's some examples of different types of self-injury that you may observe or people may engage in. It's not only cutting, it can be pulling hair out, it can be hitting a person's self that results in bruising or breaking the skin. We know that there's immediate damage to the skin. It happens in that moment. So there's a reward, if you will, at the practice of that. I'm sorry, my dog is like kicking me in the knees right now. That's why I'm kind of wiggling around. So I apologize for that. My canine coworker feels that she needs some attention. And again, I touched on the piece that it's intentional, it's purposeful, there's a plan, there's a thought process that goes into it. And the result of the behavior is that there is an injury every single time that it's incurred. And those injuries most likely in virtually 95% of the cases of self-injury are not about causing pain. It's about finding a way to release or to feel something that is going on in that person's life to help them feel more able to regulate their emotions. So here are 10 different methods of non-suicidal self-injury. We can see that it ranges everywhere from impacting with an object to tearing or ripping skin, perhaps even burning skin. So I would like for those of you that are on this webinar this evening to take just a minute and use the chat function to identify what you think is the #1 most frequent method that people engage in when they're practicing self-injury.
So we've got cutting, ripping, tearing skin, cutting.
Cutting is the one that we hear the most about, that seems to get the most attention. It's not the most frequent method, though.
Scratching or picking scabs. Hi, Lee. Lee Clawitter's on here too. She's a counselor at West Middle. Tearing skin.
Thank you, everyone, for sharing those ideas. I want to just share the results of that and sort of loop you in on how those 10 different methods sort of rank. And this is based on a study that was completed with young college students, and over 2,800 college students participated in the study. Almost 20% of them reported that they did engage in self-injurious behavior. 50% of all students who reported that said that it was scratching or pinching. So we frequently overlook this very typical behavior in some cases, but it can escalate into other types of injury. About a little over 1 in 3 students identified that it was impact with objects, so either hitting themselves or bumping into hard, solid objects that could result in bruising or perhaps even tearing of the skin. Cutting comes in third. And so just 1 in 3 students reported that as their behavior of choice, if you will. Impacting with oneself, about 1 in 4 students reported that was the behavior, and that would be sort of like hitting themselves in the head, punching themselves in the arm or the leg that would create bruising or some other sort of visible response. Ripping skin, carving into the skin, either an intricate design or some sort of word, perhaps. About 15% reported that. A little over 10% reported interfering with healing or picking with scabs or not tending to medical concerns. Burning is really kind of an interesting one because it's not necessarily using flame or fire. It could also be hot objects like the stovetop. It could also be using ice with salt, putting those two components together that can create a burning of the skin. And then the last 2, we see rubbing objects into the skin. So having sort of a repetitive behavior of just rubbing the same spot back and forth until it becomes raw. and hair pulling. About 1 in 10 of those that participated in the survey reported that hair pulling was the method that they predominantly found most helpful for them to bring relief. And as we look at these in this order, we can sort of see how one can escalate into the next behavior. And so it's important to not only stay focused just on cutting as the primary method. It's, as I said, it's the one that we typically kind of lean to. If I had $1 for every time somebody said cutting and made this action where they, pretended to cut their wrist, I would be able to retire. But cutting it is not always the only thing that we want to be alert and aware of, and particularly with students. So we already talked about these two. So in addition to the other types of behaviors, we have suicide attempts. And these, what makes suicide attempts a little bit different, or very different from non-suicidal self-injury, is that the intention of the behavior is death. People engage in this behavior because there is a desire to not want to be alive, to completely remove themselves from whatever situation they're experiencing. In many cases, suicidal thoughts are grounded in an overwhelming psychological pain that is difficult to explain, that is impossible to see, and can be associated with mental or behavioral health concerns, either diagnosed or undiagnosed, or could simply be the result of circumstances or situations that people are finding that very difficult to manage or to live through. This is a definition from the Centers for Disease Control of what is a suicide attempt. And it's engaging in a behavior that could potentially result in injury, but the intent is to have death. It may or may not result in injury. It depends on what method somebody might engage or use. And so again, just the difference between non-suicidal self-injury and a suicide attempt. It's important that we understand that intent is really the key piece in both of those definitions, whether it's non-suicidal self-injury or a suicide attempt. And intent is comprised of a couple of different components. It's having a plan, being firm in what you want to do, and also having easy, ready access to lethal means, having prepared or practiced whatever the process might be to make that attempt, having talked about it, either coming right out and saying, I'm going to kill myself, or maybe perhaps hinting at not wanting to be alive any longer, something along the lines of, I can't take this anymore, it doesn't really matter. And it could also include that attempt could be in the progress. So depending on which of those pieces are in place is going to help us really distill the intent behind the behavior. So I want to just quickly share with you this document. This is from the National Suicide Prevention Lifeline. This is the standard that they use when they are doing lethality assessments. And we can see that it's comprised of really exploring what is the desire of the person that is experiencing thoughts or feelings of suicide. What is their capacity? What's their capability? Are they able to really follow through on that plan, on those thoughts? Is the intent to end their life? And you can see the 4 different categories there. But it's also comprised of buffers. What are the things that help people stay safe? What are the protective factors that they might have that could be ramped up, that could make their thoughts or feelings of suicide less impactful, that could help them see more of the life side versus only focusing on the desire for death. So when we're talking about non-suicidal self-injury, there's just a couple of points that I want to run through, not necessarily data points, but just give us some perspective. We know the prevalence of non-suicidal self-injury is great, just estimated, because we don't always know how many people are practicing non-suicidal self-injury. It could be as few as 400, as many as 1,400 per 100,000. The intent is to modify or to temporarily reduce emotional distress. Typically, methods are low lethality. The possibility, the potential of ending your life by picking or burning yourself is very low. Actually, the possibility of ending your life by cutting is also a low factor. It takes a long time to bleed out. There's typically an opportunity to be found or to seek help after once cutting, changing your mind. While it's a common method, it's almost always present in either a community or a clinical sample. So we see it across different disciplines. There are typically many episodes or many attempts at non-suicidal self-injury. We see if somebody, as an example, were to choose pinching, we would see lots of bruising, lots of marks on people's arms and legs are typically the areas that people focus on, predominantly because they can see the result of that injury. And that is part of what helps to reduce the anxiety or the distress that person is experiencing. We know that there are multiple methods that people might consider using for non-suicidal self-injury. The ideation around thinking, connecting the behavior to thoughts of suicide is not frequent. There typically are more reasons for living in somebody that's practicing non-suicidal self-injury than in somebody that is experiencing suicidal thoughts. Relief is really what's behind the practice of non-suicidal self-injury. It is trying to find some sort of emotional release to help calm, to help let go of helplessness and hopelessness. And it's something that happens pretty quickly. It's an immediate release, an immediate opportunity to let go of whatever negative affect or emotions might be present in that moment. People are very vocal about non-suicidal self-injury. Folks that practice that feel judged. They're actually condemned, told that it's a bad thing that they're doing, that those behaviors are awful, that they shouldn't engage in that. And so there's not a lot of support for other options that people could explore with regard to self-injury. It's very shameful, and people feel very overwhelmed when they practice it. There's a cycle of sort of a circular cycle where an individual feels that I'm self-injury, I need to let go, I need to find some relief, I need to feel something, I self-injure, I feel better, then I am remorseful because I engaged in that behavior and I will be judged. So it's a cyclical situation that's very difficult to break out of, because one piece of it feeds the next piece of it. Counterintuitive to popular belief, restricting means is often counterproductive. People will find other items or tools, if you will, that they can use to injure their body tissue. One of the most obvious replacement behaviors that has been found to be very counterproductive is encouraging people to wear a rubber band on their wrist. And when they feel that they want to self-injure, to snap themselves with the rubber band. Well, that hurts. That causes injury and pain. So you're really just, you're not doing any sort of removing of that behavior. You're just giving them a different tool that results in some sort of injury. About 50% of adolescents will report some degree of non-suicidal self-injury over the course of a year. And we see that number reduces a little bit as people age up. People of all ages engage in self-injury, but we see that the numbers start declining as people age up, perhaps as an opportunity that they've gotten the help that they need, or they are able to better manage their emotional dysregulation in more acceptable ways. We know that the behavior is repetitive, and so very seldom is it just one incident that someone engages in. And so just, a little bit of data to support some of the thoughts and ideas around self-injury. But one of the things that makes this conversation relevant for us this evening is that the average onset is during adolescence. And we know that there are many things that cause stress or anxiety for young people. And if healthy coping strategies aren't encouraged or are not available, it's very likely that these unhealthy behaviors could develop and could escalate over the course of those adolescent years. There doesn't seem to be a huge difference from male to female, and I've got some information that I'll share in just a minute about the different types or the different manners that male versus female people will engage in. And we also know that for our LGBTQ youth, that they're just equally as likely, if not at a higher risk, of engaging in this behavior as well. Here's the gender difference. We find that females are reporting these different types of self-injury, scratching and cutting, that it's habitual, that it's perceived as interfering in their life. They're also more likely to seek mental health support for the behavior, recognizing that it's unhealthy and that there are other alternatives, places that they can turn to. When we're talking to males, it could be identified as just a response to engaging in substance use. They in many cases will self-injure in front of other people or as part of a routine. So an example of that might be engaging in a sport that can result in injury, which we know many of the sports that young men engage in can result in injury. So that could be sort of purposeful, putting themselves in a situation where they might get injured or hurt. The behavior typically tends to be a little more obsessive compulsive as a diagnosis that we see in males. So just a little bit of difference along those gender lines. When we're looking at risk factors, some of the things to be alert and aware of would be any sort of history of trauma, abuse, or neglect. And there's a growing body of research around trauma and being trauma informed, recognizing that people behave today based on what's happened to them in the past, as well as how they were either supported or helped in the past. And so someone that has that type of history may have adopted self-injury as a manner of managing or regulating their emotions. Mental health conditions can be present. They're not always present, but the ones that are most closely aligned with self-injury include depression, anxiety, and eating disorders. Again, some people would make the case that an eating disorder is in fact self-injury. You are not eating nutritiously, and you are able to visibly see the results of that control over managing eating habits. So what are some reasons that people might self-injure? This is just a kind of a list. I've already sort of touched on relieving stress or anxiety as a way of dealing with frustration. Some people use self-injury as a way to cope with anger. The one that I find really interesting is some people report that it's the only way that I can experience emotion, that I can feel anything, or that I can cry, that I can release that pain. So you can see that it's kind of all over the board why somebody might elect self-injury as a coping strategy. We also know that people may self-injure in hopes that somebody might notice that they're experiencing pain that they can't verbalize, or to get somebody's attention in a very shocking way. There is some copycat behaviors that occur with self-injury, so that's something that we want to be alert and aware of. If one person says, well, this is how I help myself, it might help you. It's not unusual that young people would give it a shot. What do I have to lose? If it helps my friend, maybe it can help me. The flip side of that is self-punishment. I've done something wrong. I need to make things right. The only way I can do that is hurting myself because I don't want to hurt other people. And maybe it's a way to keep myself alive by not making a suicide attempt. If I can engage in these behaviors that are destructive only to me and are only hurting my physical self, that can help me stay alive. And there are a number of reports where people say, if I didn't self-injure, I'm pretty sure that I would kill myself. I don't see any other way to manage this extreme pain that I'm experiencing. I touched a little bit already about finding a way to feel something. So finding some sort of sensations to manage or control this urge that somebody may have. Again, counterintuitive. Some people find pleasure. It makes them feel much better, as well as the injuring behavior itself can feel good to them. It doesn't hurt them, which is why we don't want to say self-harm, because sometimes people engage in the behavior because it helps them feel better. Other people engage in that behavior if they are perhaps branding or burning or creating intricate designs with their cutting. They like the way that it looks. It can also be a distraction from things that are going on around that I can't control or that I don't want to give attention to. Creating opportunities to make excuses of why I'm not doing something or why I'm not participating, why I'm not following through on different things. It's important that we understand that in most cases, non-suicidal self-injury is really an attempt to control things that feel uncontrollable, whether they're emotions, whether it's something that's happening socially between friends, between family. It can result in high anxiety situations. And it also is kind of an activity that takes independence. I'm doing this to myself. I have control over my body. I can do what I want to my body, whether it's acceptable or not. There could be some issues with regulating perceptions and responses in the individual. So it might not only hinge in their self-injury, it could bleed over, that's a bad word. It could roll over into other areas of their life where they're having trouble being realistic and responding appropriately. Finding a way to engage with someone in a respectful and collaborative way when we've identified that self-injury is the behavior they're engaging in is really the first important step that we want to take to support someone. Letting them know that we're not going to be judgmental, letting them know that I'm here to help you work through this. I'm not here to take control away from you. How can we really work together to help you get to a safer place? So some warning signs that we want to be aware of would certainly be any sort of fresh injuries that we can observe on someone's body. If there are clusters or specific areas of the body that seem to be scarred or marked, if we see traces of blood anywhere in the sink, perhaps on clothing, if someone is bandaged all the time around fingers or hands, covering themselves with oversized clothing, wearing a lot of jewelry around the wrists. Those are opportunities to sort of question, tell me a little bit about all the jewelry you're wearing, all those bracelets. I can hardly see your skin. What's going on with that? It wasn't too long ago that people were collecting those plastic bracelets that had messages on them. And it was found in some cases that those collections of bracelets were actually, hiding some injury that was occurring. And so don't fall for the excuse that it's just jewelry, it's just the popular thing to do. It could be very purposeful. So how can we intervene with someone that we're concerned about and their practice of self-injury? We want to respond in a positive way, that we acknowledge that there's some sort of crisis going on, that there is some emotional pain that that person is experiencing, and they're having a difficult time explaining it or managing it or finding a way to find relief from the pain. Coming back to the intent and safety, what is the intent? Asking some questions along the lines of, what is the purpose? What is the outcome that you're hoping for with this practice of self-injury? And being clear that medical safety is a concern. Empathy and support are always going to go as far as we can, helping people recognize that I might not understand what's causing these feelings for you, but I want to be as supportive as I can to help you find a safer way to cope and manage. Education on both sides is important, talking about the risk and the reality that that behavior could escalate and could become very harmful, could also result in unintended injuries. And then knowing who in the community can help us to help them, to help people who might be struggling with thoughts of injuring themselves as a coping method. We're really lucky here in St. Louis. We've got a great organization called Safe Alternatives, and I'll share that information with you in just a moment. So just some quick steps on how we can respond in a helpful and supportive way. I've mentioned already being as non-judgmental as we possibly can and intervening as quickly as we can. A colleague of mine refers to it as respectful curiosity. We want to ask questions. We want to try not to be shocked or overwhelmed by what we hear. And we don't want to minimize that person's explanation of their emotions or the purposes or the reasons that they feel compelled to practice self-injury. One thing that we really encourage people is don't demand to see the wound unless there is some sort of concern that it might be a medical issue. Many times, as I said already, people feel significant remorse for engaging in the behaviors. It's a huge embarrassment. And so being forced to share or display the results of their self-injury only adds to that remorse and that emotional pain that they're experiencing. Here's some examples of direct questions and language that can be used to help have this conversation. Learning what's the window of time that this behavior has been happening, on what parts of the body is self-injury occurring, what steps are being taken to tend to those injuries. Is there access to bandaging, access to antibiotics, access to soap and water to make sure that things are clean, as clean as they possibly can be. And then this last one, have you ever injured yourself so badly that you were worried about whether that wound would heal or become infected? That can be a very telling question because, again, that leads us into that better understanding of what is the intent behind it. As I've said, in most cases, people are self-injuring without any intent on it resulting in their death. And so if there ever has been that injury where it has been so significant that there was a concern that the healing or infection or death could be the result, that could be an indication or a piece of information that we could use to continue to impress upon this person how important it is to find other ways to cope and manage with some of the emotions and feelings that they're experiencing. Here are some additional opportunities or ways that you can collect information or be curiously nosy, if you will. Tell me what you hope will change. What's the outcome that you're hoping for as a result of this self-injury? What are the things that lead you to feel that self-injury is what you need to engage in? What's driving these feelings that are pushing you towards self-injury? What's happened in the past when you've self-injured before? Is it always the same thing that's causing these feelings for self-injury, or are they different situations or circumstances? Exploring what are the other ways somebody may try to manage or ease their pain could be very helpful. Suggesting, is there an alternative to self-injury? Is there something that you could try, is something that you could maybe do that might be more helpful, and an activity that you can engage in? Really exploring what are the feelings and emotions that someone experiences after they self-injure. That can help us to identify what are some other activities or alternatives that could also result in that same emotion or feeling. Trying to avoid the problems, whatever might be contributing to thoughts or feelings of self-injury, what can we do to shift the pattern or change the direction, so that these problems or situations don't continually come up. And then just doing some forward thinking, being a little proactive. Is there a better way that maybe these feelings could be handled the next time you feel this way? People are much more likely to try alternatives if they've sort of thought about what to do before, instead of feeling unable to identify what are my options. The only thing I know is to injure myself. That's the only thing that helps. Maybe planting some seeds, some ideas of, here's some activities that might be helpful in managing those emotions if they were to come back again. A couple of things that we want to try to avoid doing, certainly being judgmental in any sort of way in the questions that we ask, or putting any sort of punitive spin on the conversation. We really want to stay away from anything that starts with the word why, because that automatically creates defensive-ness in people. We also want to try to stay away from, lecturing on why this is so unhealthy, reasons that it shouldn't be a behavior, focusing only on the dangers of self-injury. The reasons that we want to avoid some of those things are folks that self-injure already know much of this. They don't need to be reminded of some of these deficits or some of these lapses in their coping and problem solving. We want to assess what is the immediate danger. Do we need medical care? Do we need other type of intervention? Is there any potential that suicide could be part of this behavior? Is there a situation where there's contagion? Are other people engaging in this behavior as well? In some cases with self-injury, particularly with young females, it is sometimes done in group settings. So they'll do it together. So we can see that sort of that peer piece of it can be very problematic. Some folks will say that the real risk of self-injury occurs when people do it privately, because when they're doing it publicly or in a group, there are other people that can be available to help intervene if that injury goes too far. But that safety piece of self-injury isn't present if someone is doing it in private. It's also important that we share with young people that this is a behavior that is prevalent in the student population, and we want to be part of the process of helping students and young people feel that they do have other options in ways that they can cope and manage and deal with some of the problems or frustrations or emotional distress that they're experiencing. We want to try and engage that individual and other people that are supportive for them. Let's look at what's really underlying, what's causing this behavior. We know the behavior is the response to either internal or external circumstances or situations. And how can we identify what are those circumstances or situations that lead to this behavior? And how can we mitigate some of those situations from escalating to a point where self-injury is the option that is automatically turned to? Knowing who in our community we can turn to get either education or care is important, as well as collaborating with school staff on care and intervention. We want to make sure that everybody's on the same page, that we're able to not only identify, but also collaborate on ways that we can help young people to stay safe. Education is really important. Participating in this webinar this evening is one step in helping yourself have a better understanding of what are the signs, what might some of the symptoms or the feelings or expressions that somebody's engaging in self-injury And what are some appropriate response strategies to that? Recognizing that contagion is very real, and we want to make sure that the young person that we're talking to has an understanding that this is a potentially very hurtful situation to another young person, and we don't want to be part of the process of continually perpetuating self-injury as a coping strategy. Knowing where to refer to get help and not feel that you're the only person that can shoulder this is an important piece. And so, as I've said before, knowing who the community-based providers are, as far as either therapy or counseling, to get that help and support. Because we really want to lift people up and help them get to a safer place. The question frequently comes up, well, you know, it's called non-suicidal self-injury, but is that a suicide attempt? And as I mentioned a little bit earlier, there's a specific difference between the attempt and suicidal non-suicidal self-injury. So no, not always, because it's more of a manner of regulating emotions. However, anytime somebody's willing to damage their physical self in any way, something pretty serious is going on. That's why we need to be aware of how these behaviors can sometimes escalate if we're not able to get help. But again, being mindful that there are some differences between non-suicidal self-injury and a suicide attempt that have to do with intent, as we've discussed. How much distress that individual is experiencing and what that distress is comprised of. What's the thought process? How are they thinking about it, and how constricted are those thought processes? How narrow is that window of thought that the person practicing self-injury is finding? How much physical damage is happening, and how is it being tended to? What happens after that behavior? What happens after the injury? What's the outcome? And as I said, you know, there's some type of underlying distress that needs to be identified and addressed. If we can figure out what that is, in most cases, non-suicidal self-injury can be overcome, and people can recover from that and find other ways to cope when they're feeling that life is too difficult, that their emotions are hard to manage, and that this injury to themselves is the only way that they can work through that. So when we put suicidal behaviors side by side with non-suicidal self-injury, we looked at the non-suicidal self-injury a little bit earlier. Now I want to just sort of layer in the suicidal piece to again kind of highlight the significant differences. We know that suicidal behaviors are typically low rate behaviors. 10 deaths by suicide per 100,000 people in the population is the average, so we can see that's much lower. The intent, as we've already talked about, is very different. It's a permanent termination of consciousness. Lethality typically tends to be very high in methods that people who make attempts to end their lives will choose. We know the highest lethality is firearms. Over 60% of folks that die by suicide use a firearm. And so anything that we can do to put time and distance between someone that is struggling with thoughts or feelings of suicide and their ready, easy access to a firearm or any other means of death is a good strategy to reduce that risk. We identified cutting is a common, not the most common, but a common method. But again, as I reported a little bit earlier, almost no one dies by cutting. And just a little bit of data right there, the low percentages of people that death is the result of their self-injury. Already mentioned that it's a low rate behavior, even in severely mentally ill persons, versus perpetual or persistent episodes of non-suicidal self-injury. Typically, only one method is employed for when people are considering suicide. They don't have multiple different methods that they might choose. Whereas with non-suicidal self-injury, there could be multiple tools that somebody might use, a sharp knife or razor blade, or perhaps even the cap to a pen. People have used that to sort of scratch and injure their skin. The ideation behind suicidal behavior is very few reasons for living, virtually no connections to life. Hopelessness, helplessness, worthlessness, poor problem solving are very dominant in suicidal behaviors, whereas in non-suicidal self-injury, it's really more of how can I help myself feel better right now? I need to take action immediately. This piece about how others respond to someone that is suicidal, there typically tends to be a greater amount of concern and support, trying to be protective and helpful, as compared to feeling judged when people are practicing self-injury. So there's a very big difference between that reaction. Restriction of means, as I've already talked about, is one of the evidence-based methods to prevent suicide. So it's one of the steps that we know can help people stay alive, but the reverse is the case when we're talking about non-suicidal self-injury. So just very quickly, I wanted to share some of the warning signs for suicide. Looking at changes in behavior, whatever is considered to be a typical behavior for a person, whether it's being on time for appointments or doing their homework, the amount of food that they eat, what is their interest in activities or participating in different events. What are the social circumstances that person is experiencing? Are they connected with other people, or are they more isolated and withdrawn? Having a sense of not belonging or being part of a peer group or being accepted by others, and having difficult relationships, either problems with parents, problems with friends, problems with teachers. Warning signs for young people that are emotionally based have to do with being easily frustrated or irritable. Having thoughts of not being good enough, or I'm not a good person, I hate myself, people hate me. Having those mood changes or mood swings that are kind of all over the place, not being consistent with moods. Then we also have verbalizations, the things that people say. We want to listen to what is said, because sometimes things can be just sort of indirect. It doesn't really matter anymore. I have no future. Sometimes I want to just go to sleep and never wake up. Following through, asking, what do you mean by that? You have no future? Just tell me more about what you mean by that. Or they could be the more specific and direct statements. It just doesn't make sense to be alive any longer. It's not worth it. Being alive is too hard. Or even coming right out and saying, I'm thinking about killing myself. So one of the things that we feel at Kids Under 21 is really important is that whether it's suicide or self-injury, non-suicidal self-injury, we really want to take those conversations to a higher place and make them a health and safety priority. People want to stay safe. They just struggle with how to do it. If you were to have a conversation with someone that was self-injuring, they would say, I don't know any other way to help myself. This is the only thing that helps. And so instead of only focusing on the why are you doing this behavior, let's focus on how can we help you feel better so that that behavior never has to be part of your day-to-day life. What can we do to help you stay safe emotionally and stay safe physically? So if we see warning signs that we're concerned about, whether it's suicidal warning signs or warning signs that somebody could be practicing non-suicidal self-injury, we want to just really have a short conversation with ourselves. Recognize that these things don't seem right. Something doesn't feel good about this. What have I seen or what have I heard that concerns me? What are the behaviors that I've observed that lead me to believe that perhaps this young person might be practicing self-injury? Are they wearing very heavy clothes, long sleeves during the summer? Are they not wanting to come out or to spend time with friends or family? How long have things been different? Is this something that just recently happened, or is this something that's been trending for quite some time? What are the attitudes or the opinions that have shifted about that person themselves, about other people, about relationships? What are the feelings or the emotions that I'm hearing in conversation? I'm feeling worthless. I'm hopeless. There's no help for me. Things are never going to get any better. Those sorts of attitudes and identification of emotions can be strong indicators that someone is really struggling. Are there other people that are familiar or aware of this situation? Do friends know that self-injuring is occurring? Are they involved in that self-injury practice themselves? Do people at school know about this? People in the neighborhood? And as I said, how long have things been different? In what ways, and what's that time frame look like? Because asking ourselves these questions can really help us to recognize that there are things that we can do, things that we can say, actions that we can take to help interrupt that process of either the self-injury or of any sort of suicidal thoughts. So the steps for intervention, what are the things that we can do that can support someone that might be practicing self-injury or might be unsure of how they can best cope with their circumstances or situations, or finding ways to regulate their emotions. Again, we want to just respond in and acknowledge that we see that that person is in pain, that crisis is evident, that we see that things are not going well for them, and how can we help them work through that. We want to revisit what's the intention, what is your hope of the outcome for this self-injuring behavior or these thoughts of suicide. Again, responding and engaging with empathy. I may not have the same experience, but I know what it feels like to feel distress, or I understand how overwhelming things can sometimes become, and what part can I play in helping you feel a little more supported and a little more cared for. Education is really important, educating ourselves, educating others that risk is present, and it's a reality. It's not something that might happen. It's something that very really could happen. And community resources are very important. Where can you turn as someone that's practicing non-suicidal self-injury or thinking about not wanting to be alive any longer, having thoughts of suicide? Where can you turn to get that help? Where can I go as a concerned parent, as a concerned caregiver, as a member of a school community, to get some help and support? So knowing community resources is very important. Some of those resources might include telephone hotlines. Kids Under 21 has a youth-friendly telephone hotline. We train volunteers, youth volunteers, to staff the hotline. We're very lucky that through the St. Louis County Children's Fund, we have the Youth Connection Helpline, which is available in many different capacities, either by calling, by texting, visiting a safe place. I already mentioned Safe Alternatives as an option to get more information, and here's their website. They have a really robust website with lots of great information. I encourage people to use Safe Alternatives because they're just at the top of the game. We also have the National Suicide Prevention Lifeline for us here in the greater St. Louis metro area. Those telephone calls are fielded by Behavioral Health Response as well as Provident Behavioral Health. So calling that 1-800 number, you will be connected with a local resource that will be able to provide not only referrals, but also provide in-the-moment support. Many people are more comfortable texting, so we're very lucky here in the state of Missouri. We have our own short code for the crisis text line, and that short code is MoSafe. Text that to 741-741. And you'll be connected with a trained volunteer to help take a hot crisis situation down to a cooler, calmer, safer place. This is a really terrific website, youthsuicidewarningsigns.org. It has warning signs that are relative not only to suicide, but also to non-suicidal self-injury. And it takes the perspective from different categories. So there's a youth perspective, a healthcare professionals, parents and caregivers, gatekeepers, and then just some general information. So it's a great one-stop shop, if you will, to get some additional information. So to just kind of review, when we're talking about self-injurious behaviors, if we're concerned that somebody may be engaging in self-injury or planning a suicide attempt, ask about it. Asking about thoughts of pain or distress or suicide is not going to give somebody the idea that that is what's going on with them. It really gives them permission to share and talk about what they're experiencing, how they're feeling, and how they're processing those emotions and feelings. And it also lets that person know that we are somebody that's concerned, we care. We might want to try to reach out to other people to see if they have observed or have these same concerns. We want to be persistent and validate and be as empathic as we can, even though we might not understand what's driving some of these feelings. We can still try to make that connection. I think it's really important that we realize that the behaviors that we're observing, that's not the problem. It's everything else that's going on in that person's life, things that they can control, things they can't control, emotions that seem to be raging. The behavior is the fix. That's what's going to make everything feel better, or that's what's going to make everything go away. So again, back to the statement that I made a little bit earlier, you know, that being curious and asking those questions and being persistent. We don't want to focus just on the behavior. We want to focus on what's driving the behavior, because those are the things that can be changed. Trust yourself. We all have the capacity, if we are able to just be patient and listen, to help somebody work their way through difficult situations by sharing our hope with them and being as supportive as we possibly can. Having resources ready, knowing where to turn, knowing how to make that connection. Maybe it's passing along a telephone hotline number. Maybe it's going online and learning a little bit more about resources. However you feel is appropriate for you to be involved, that's how you should be involved. What feels appropriate for you, be as involved as that role will permit you to be. I like this statement because, you know, our job is to be part of the process of connecting people to the help that can help them stay safe and alive. Again, that perspective of let's make this whole task of non-suicidal self-injury or even suicidal behaviors a safety priority, a health and safety priority, because people want to stay safe, people want to stay healthy. Let's figure out what we can do to be part of that process. So I appreciate your time this afternoon, actually this evening. I hope that some of this information that I've shared with you has been helpful. I'd be happy to take any questions if there are questions, Dr. Schulte.
We had a couple people raise their hand during it, and I asked them to use the Q&A and chat, but they have not yet done so. Okay. So if anyone has any questions, feel free to pop it in the Q&A in the chat, and we will have Elizabeth answer them. And you all see her information up here. I'm sure you can reach out. Otherwise, we will have this recording available starting tomorrow morning, I think, or tomorrow afternoon, probably. So we will be putting that on the Parkway website, and or if you just want the link, feel free to shoot me an email. It's just eschulte@parkwayschools.net. And I'd be happy to get you the recording while we maybe wait for some people to pop some questions in the chat. Elizabeth, I think so much of what you said is so important to note. And one of the most important things that you said more than once is, you know, we're not giving anyone ideas when we ask about this. We are so many kids, and Chris, you might be able to attest to this, but it's like almost like they're just waiting for us to notice and ask. And that's asking is such a way to show that we care about them and that we love them, is that we're concerned enough to ask that question, that hard question. And I think that was a really good point that you made. Okay, I'm not seeing any questions, so we will hang out here and thanks so much to everyone for being here. And if you have something, we'll hang around for just a minute. But otherwise, we hope you all have a wonderful evening and a wonderful winter break as well. Thanks so much. And thank you,
Thank
Elizabeth,
you.
for all that really, really great information for families.
My pleasure. Thank you for the opportunity to be with you and your parents this evening.
We appreciate you so much. You've been such a good resource for all of us. And you in the chat, thank you so much for the presentation. Very helpful information. Happy holidays. Oh, here we are. Are you seeing more of these signs during the pandemic at school? Chris, that might be a question for you.
I would say not necessarily. I think these issues have always been around, even when I was young. Now, I would say in the last 20 years that I've been a school counselor, I have seen it more and more, for sure. I wouldn't necessarily say it's an increase, and granted, with us being virtual for part of the year last year, we didn't see it as much, of course. And then when we came back in, it was just a little bit different. And with us only being at school for like 4 months, we do see, kids definitely struggling with coping skills, though.
Thank you for that question, and thank you for that answer, Chris. All right. I don't see any more. So again, thank you all so much. We appreciate you and just hope you have a wonderful, healthy, safe winter break.